Bisho Hospital medical staff will soon be sleeping easier on site. Non-profit organisation Gift of the Givers is expected to open the doors of their newly renovated quarters. The organisation has upgraded the Eastern Cape Health Facility's staff accommodation. The R3 million upgrade was completed within a month. Can you believe that? Well, let's discuss this further now with the organisation's Imtiaz Sooliman. Imtiaz, a very good morning and thanks so much for your time. Another big project that's been rolled out with speed, I must say. Just tell us, what work did you have to actually do at this facility? How much work was there? What conditions did you find?
Good morning, Uveka. Thank you very much. The facility was in a very, very bad state. Electrical work, plumbing, books, paperwork, boxes, dirt, everything was dumped in this building. It was not good for human utilization. But it was one of the only buildings, well, one of two buildings that was available on site. It had the right dimensions, it had the right structure, it had the right setup. It needed the building intervention. And we've done other interventions before in Mitchells Plain Hospital, in the Frisia ward in Cape Town. We've done settlers in Makanda. And so this was just another challenge that we could deal with. And all credit to the building team that worked so fast. You know, they did Mitchells Plain in 30 days, they did settlers in 5 days, and this took just under 30 days because of the long weekends and holidays. But they looked at it and they said, okay, we need to install more walling, redo the electrical system, redo the plumbing system, fit in ablution blocks, a kitchen, a dining area, a lounge for the medical personnel to make it very, very comfortable. And of course, equipped with all the furniture. And that's what they did throughout the Christmas and New Year period.
So this accommodation expected or opening today will be available. Who does it serve, Imtiaz? And how will this actually change how this facility will be able to serve the people in that area?
Look, we've been supporting Bisho Hospital for quite some time last year. When we went in and when we saw the virus cases climbing, we realized it was very central to many of the areas around East London because Nelson Mandela Bay Metro was already overwhelmed. So to take the pressure off there, we said, let's set up a big facility here. And we put up a 120-bed COVID-19 facility, but that requires staff. We put in high-flow machines, we put CPAP machines, and then the CEO, Sister Pumla, told us, look, we are at a disadvantage. When doctors or interns or community service doctors are allocated to us, they come here and within 24, 48 hours they leave because we don't have good accommodation for them. And she said, now in the crisis when we really need personnel, we're going to lose them again. And they're all going to be in January. Can we do something? So it was for those personnel. The hospital mustn't lose them so they can service that 120-bed facility we put up. And of course, the hospital as a whole as time goes by.
So this is not the end of it, though. You are planning an addition to all of this. What's the plans there?
There is another facility right next to the one we've done. We're just looking at the funding and seeing how feasible it is to us. But it's another building that can be really beautifully done up. And we're hoping, that something will work out and we can give the contract for that one soon. And if that happens, there'll be a very good complement of medical personnel on site, available to assist in COVID-19. And after COVID-19, of course, for everything else the hospital requires.
Now, we know lots of concern, Imtiaz, over the situation, the COVID situation in the Eastern Cape not too long ago. But it seems that that has changed. We're looking at the Eastern Cape numbers now, and, it's very, very encouraging. You've played a big part in what has happened there and what we've seen happen. What still, though, are the major challenges in that province, which at one stage, we had a major red flag popping up over?
The challenge is the provision of oxygen. Look, you asked, the figures are coming down, but we have to be honest, the figures are not accurate. Not that anybody's manipulating them. A lot of people have passed on in their homes. A lot of them have passed on in their cars. A lot of them haven't made it to the hospitals. A lot of them have died in the queues, and a lot of them have died in casualty. Also, we've been getting figures from the bigger hospitals. But there's still a crisis in many of the small hospitals, the feedback we're getting. But of course, it's much better than what it was, a short while ago. And the biggest challenge now to save life is to upgrade the oxygen capacity in many of the hospitals, which the Eastern Cape government is working with. We've provided the CPAP machines which we've rolled out. They take much less oxygen than the high-flow machines that require oxygen. And the feedback we're getting is phenomenal, not only from the Eastern Cape, but from 6 provinces that we give the machines to. And they're saying, look, these are life-saving. And for those machines to work, obviously, they require oxygen upgrades. And that's the challenge a lot of the hospitals have. They call us, they say, look, we have the oxygen systems, but oxygen is not coming quickly enough from the company that's supplying it. But other than that, the machines are working well, and some hospitals couldn't take the machines simply because they didn't have enough oxygen capacity. They didn't have the points. So once those hospitals have the points, We can then send the machines to more hospitals because these are life-saving. And the Department of Education, Department of Health in eNCA has given us another list of hospitals that require the machines. But of course, it has to be upgraded for oxygen first.
Well, Imtiaz, and it's wonderful work that your organization does, and you've been so busy, and you've managed to do in a short space of time what the actual authorities who should be doing this job have not been able to do in years. So I just want to know from you, while you do this, while you get money, yes, out of the goodness of those who want to donate and can donate to your organization, is there a sense though that maybe authorities tend to lean too heavily on organizations like yours to do the jobs that they actually should be doing or should have done, so they would not have ended up in a situation like this?
Uveka, I think the problem is government is caught up in a lot of bureaucracy within itself. The National Health Department can't dictate to the provincial health departments what to do. They've got to look at the system of working. The mistake that was made from the beginning was a national disaster facility was not set up. This is not an ordinary crisis. This is a disaster. And it requires a one set of command, one chain of rules, one set of rules, one chain of command from one structure at the top, where it includes the police, treasury, buying power, staff, health, and a set of instructions need to go out that this is the crisis. Points number 1, 2, 3, 4, and 5 have to be done, and we have to implement this immediately. That wasn't done, and everyone is pulling different directions. Our advantage is we've been disasters for 30 years.
Yeah.
On March 15, we already mapped out what needs to be done, and we just ran with it, and the program hasn't changed. We just adapted as we went along as new challenges came. And a lot of people have goodwill, but they just don't know how to do it.
Yes.
Our advantage is we know how to do it, and that's why public support us. And the other thing is, if we have to wait for government officials to work, a lot of people are going to die.
Yeah.
And our aim is to help people as fast as possible.
Well, hats off to you and your organization, Imtiaz Sooliman from Gift of the Givers there. Well, let's take you from there now to Help Makar College in Braamfontein here in Gauteng.